Hi, my name is Morgan Coulter. The date today is August 29th of 2020, and this is my Unit 4 case study assignment. So I first chose to do case study 2 as I thought it was interesting and I wanted to learn more about the situation. So case study 2. I chose to research and solve case study 2. This case presents with a 4-day-old infant, excuse me, whose birth weight was 5.9 pounds, and there was a normal pregnancy and birth. The newborn screening tests that were completed at the hospital showed a phenylalanine, or PHE, level of 6.6 milligrams per deciliter, where the normal range is typically 1 to 2 milligrams per deciliter. A presumptive diagnosis of phenylketonuria was made, and then more samples were taken for a further evaluation of the patient. When asked, the parents of the infant denied that there is a family history of PKU, or phenylketonuria. When the infant was at 14 days of age, phenylalanine, or PHE, dietary restriction therapy was started on the infant, and this showed a good response of plasma phenylalanine levels, and those levels were dropped to the normal range of 1.65 milligrams per deciliter. Phenylketonuria is caused by a mutation in the gene that aids in the production of an enzyme called phenylalanine hydroxylase, or also known as PAH. Phenylalanine hydroxylase is essential to convert phenylalanine, which is an amino acid, into other substances that the body needs. When phenylalanine hydroxylase is defective, then the body is unable to break down phenylalanine. An individual may have phenylketonuria if it is inherited from their parents. This disorder is often inherited recessively, so both parents would need to contribute a mutated version of the phenylalanine hydroxylase gene in order for the child to develop phenylketonuria. And if both parents have phenylketonuria, then the child will have the disorder as well. A test was completed with another infant, and this infant was called Infant B, where they were being evaluated for a suspected diagnosis of phenylketonuria. BH4 loading tests were completed on both patient A, which was the patient we spoke about earlier, and the new patient, patient B. The results from the BH4 loading tests were presented in a graph. In the BH4 loading test, tablets of synthetic cofactor are dissolved in 20 milliliters of water in a dim light, and then they're administered to both patients at least 30 minutes before having a meal. The patient's blood was drawn before and 4 and 8 hours after the BH4 loading test. The phenylalanine, or PHE, levels in the patients were also determined. We were then asked to summarize the results of the test completed for patient A and patient B. I found that BH4 is essential to carry out the chemical reaction of converting phenylalanine to another amino acid, which is tyrosine, with the help of phenylalanine hydroxylase. And this is deficient in patients with phenylketonuria. The test results from the study show that when BH4 was administered in patient A, the levels of phenylalanine are elevated as the hours pass on. This infers that it is impossible to convert the amino acid phenylalanine by metabolism to tyrosine. Patient B in this study shows that the phenylalanine levels fall as time goes on. This shows that phenylalanine is metabolizing and becoming tyrosine and it can be concluded that the suspecting diagnosis of phenylketonuria is incorrect. And for this case study, I used a couple websites and case studies, research studies that I found online, and I included those citations in my document at the end of my paragraph. So the next case I decided to complete was case 3. So here's case study 3. I also chose to investigate case study 3, which presents with a 47-year-old man who's complaining of severe pain in his right great toe. He reports being unable to bear weight on his right foot and had no trauma to the area that he knew of. He was diagnosed with gout based on his physical exam and his laboratory findings. It was found that his plasma urate level was 10.5 milligrams per 100 milliliters, where a normal value is typically 7.0. His urinary uric acid level was 215 milligrams per 24 hours, where a normal value is typically 413 plus or minus 78 milligrams per 24 hours. After researching, I found that gout is an inflammatory disease with symptoms of swollen and painful joints, which is a result of precipitating uric acid crystals. With gout, there is an occurrence of decreased renal excretion and/or an increase in uric acid production, and this leads to hyperuricemia. The patient in this study has a higher plasmic uric acid, or UA, than normal. A cause of higher plasma uric acid is often a low excretion of uric acid. The patient also had a lower urinary uric acid of 215 milligrams per 24 hours compared to a normal value of 413 plus or minus 78 milligrams per 24 hours. This shows a decrease in urinary uric acid as compared to a normal level of urinary uric acid. Therefore, the root cause of the gout is decreased urinary excretion of uric acid in this patient. To detect if the man has an overproduction of purines, he could be tested to see if he shows a greater activity of the enzyme phosphorybosylpyrophosphate, or PP ribose P, synthetase than found in individuals without gout. To see if decreased salvage of purines is the explanation for gout in this individual, then the enzyme purine nucleoside phosphorylase, or PNP, could be checked. Purine nucleoside phosphorylase is in the nucleotide salvage pathway and is found in many tissues. It is found to be the highest in the liver and hepatocytes, sinusoidal endothelial cells, and Kupffer cells. There is no indication of a decreased salvage of purines in this 47-year-old male. The case study also explains that the patient switched from drinking diet soda to regular soda because he read that fake sugar in diet soda was bad for him. He states that he drinks between 4 and 5 liters of soda a day. It has been found in several studies that there is an increase in the risk of gout with sugar sweetened drinks, such as soda. This has been found in both male and females. It was found in a certain study that one drink sweetened with sugar per day can double the risk of a woman developing gout in comparison to a woman who had less than one drink sweetened with sugar per month. Therefore, drinks sweetened with sugar and fruit juices are associated with an increase in the incidence of having a gout attack. It was also shown in studies that drinking diet soda is not related to an increase in frequency of gout attacks. The 47-year-old male should stop drinking as much regular soda since it could worsen and increase his gout attacks. He potentially could drink diet soda again if recommended by his physician. And I had several websites and research studies that I found that supported this information, and I included those at the bottom of my document. So thank you for listening. Bye.